I think it's clear that there are many more people with COVID than are being diagnosed, partly because of the changes to eligibility that were necessary so we can focus PCR testing on those at highest risk, but partly because many people have very mild symptoms. And as we know through previous waves, not everyone comes forward for PCR testing. So I think it would be fair to say that in previous waves, we've seen a range. I think I've mentioned catching 1 in 4 cases with PCR up to about 1 in 6 in the fourth wave. I think it would be very conservative estimate to say we're 1 in 10 or greater at this point in time in terms of the number of cases that we're catching, which again is why it's so important for everyone to assume that anywhere they go, there's going to be someone infectious with Omicron. And to be very clear, that's not to say that we should stop trying to slow the spread. I believe that's very important to slow the spread to protect the healthcare system. And it does take actions on all of our parts to do that. So again, I couldn't give a specific number, but it's very clear with a 40% positivity rate that transmission is higher than it's ever been before. And we should assume that at minimum, we're seeing about 10 times or more the number of cases that we're diagnosing through PCR. In order to ensure that patient care decisions are supported by timely diagnostic information, PCR testing eligibility will now be focused on those with clinical risk factors for severe outcomes and those who live or work in high-risk settings. Effective immediately, PCR tests will be available for only those in specific categories. The full list can be found on our website, but some examples include continuing care residents, healthcare workers and staff in acute and continuing care settings, shelters, and correctional facilities, symptomatic household members of a person who works in continuing or acute care, individuals with any degree of symptoms who have risk factors that would make them qualify for monoclonal antibody treatment if positive for COVID-19. This list is available on the website and includes those with significant immunocompromising conditions. All residents and workers from isolated and remote First Nations, Inuit, and Métis communities, returning international travelers who become symptomatic within 14 days after their arrival so we can monitor for new variants, and hospital or emergency department patients of any age who were ill enough that COVID testing would change treatment plans. The Omicron variant is so prevalent in our communities right now that if you have COVID-19 symptoms, such as a stuffy or runny nose, cough, fever, sore throat, or loss of sense of smell or taste, you should assume you have COVID-19 and are legally required to isolate. Please stay home and away from others for 5 or 10 days, depending on your vaccination status, or until your symptoms improve, whichever is longer. You can take a rapid test if you have one, but for most people with mild illness, a test is not necessary, and symptoms can be managed at home. AHS has updated their COVID assessment tool to help Albertans determine whether they need and are eligible for a PCR test, what type of care to seek based on symptoms, and how to take care of symptoms at home with appropriate support. The tool is available at ahs.ca/COVID screen. It should be used even before you call 811. This is a screening version for adults, and one for children will be available later this week. We must take Omicron seriously. Fortunately, we are seeing a positive uptake on third vaccine doses. On January 3rd, Alberta surpassed 1 million booster doses. That's more than 1 million people who are committed to helping each other and getting to the other side of this pandemic. I'm encouraged to see so many Albertans doing the right thing. Help us reach another million boosters and help protect yourselves, your families, and your communities. I say again that we must take Omicron seriously. It is not too late to act.